Today I sent a letter to Lillian Kohler, Director of Hawaii's Department of Human Services, demanding to know the answer to one question about QUEST Expanded Access and one question about QUEST. QUEST Expanded Access is the very controversial $1.5 billion managed care program for 40,000 aged, blind, and disabled persons, which the patients and their providers almost universally want terminated or taken away from the two mainland insurers the Lingle Administration chose over Hawaii plans, United Healthcare and Wellcare, both of which are known to be big supporters of Republican politicians. The complaint I filed in federal court to have the program declared illegal under federal law goes to trial on November 9th. I demanded that Director Kohler disclose whether the Lingle Administration is planning to issue a contract amendment actually extending the contracts with United and Wellcare, which would be in direct opposition to legislation the state legislature passed over a Lingle veto last spring, effectively ending those contracts when they expired June 30th, 2011. My belief that the Lingle Administration is planning to extend the contracts is based on the fact that the Department of Human Services is not issuing an RFP for the new contract period beginning July 1, 2011. The Lingle Administration has found time and resources to issue a new RFP for the QUEST plans, which I believe involves a scheme to replace the Hawaii plans, which are doing an exceptional job for the QUEST patients, with these two Republican mainland insurance companies. My letter insists that the Department of Human Services disclose its plans to the public. The public is entitled to complete and timely transparency where a $1.5 billion publicly funded program is the issue. Only with complete disclosure can the concerned legislators and officials, organizations, and individuals have a say in the policy decisions the Lingle Administration is apparently making secretly, leaving us stuck with two insurance companies we don't want. My letter also demands an explanation of the expected consequences of the decision by the Lingle Administration to slash benefits for 15,000 adult QUEST plan members. That was reported by Pacific Business News last week. First, slashing the benefits is not a cost-effective solution. It merely shifts the costs to the hospitals that will have to cope with a large increase in the number of emergencies for patients who are forced to put off going to a doctor because their coverage has been cut. There is substantial data that this type of cut always costs more in the long run in dollars and lives. Furthermore, my preliminary analysis of the Health Care Reform Act and federal advisories issued to state Medicaid directors is that the decision will result in the loss of millions and millions of dollars in federal funds that the Health Care Reform Act provides for expanding benefits to more adults in the group the Lingle Administration is planning to cut. My letter insists that the Department of Human Services answer these concerns with a disclosure of any analysis it has concerning the impact on the amount of federal Medicaid funds for Hawaii and comparing the amount of federal funding Hawaii would receive if it expanded eligibility as the Health Care Reform Act invites. Again, the public is entitled to complete transparency where these very expensive entitlement programs are concerned, because the Lingle Administration is using its last acts to condemn our state and its taxpayers to unnecessary burdens involving many millions of dollars which could go on for years. The Lingle Administration must come clean on these very important issues, and it must do so before it obligates us to contracts and policy decisions that have enormous consequences to taxpayers and the next administration down the road. Thank you.